When asked about the solution to chronic homelessness in our state, Safe Haven is the first intervention that comes to mind. It's the only program I'm aware of that truly meets participants struggling with mental health and substance use issues where they are and helps them move forward from there.
The Safe Haven programs that we have in the Commonwealth are based on a model that's been tested and where there's an evidence base that's been developed over the years in research in this area. The programs here include private rooms. People are given bedding and meals, provided hygiene products. There's also a tremendous amount of help provided to people in these programs, securing benefits, for example. Some people have not got public benefits, or if they do, they may need additional assistance completing applications for permanent housing or developing a housing plan and beginning to implement that plan together with staff.
The folks we work with have complex and multiple needs, major mental health concerns, major medical concerns, and addiction issues as well, often, not always, but often.
Being in the Boston area and watching what's happening at Mass and Cass, and as a person who's in long-term recovery and familiar with the 12-step programs and trying to save lives, and having lost a sister years ago to the disease of drug and alcohol use. I just think it's really, really important that we start working with models like this. And I can't tell you how much it means to hear how well articulated this is. We need this in all our neighborhoods.
Safe Haven programs are essential, I believe, and I think my co-presenters would agree, to serving the people we know now who are chronically unhoused and have significant behavioral health conditions. A lot of the other options available to us just are not fitting their needs. These folks, by the way, are among the highest users of emergency departments and hospital beds and emergency medical services. Jay talked about this. And they also have high rates of criminal justice involvement, not because they're committing felonies, but because they're committing crimes of poverty and where they may not have access to a bathroom or a place to sleep and enough food to eat. And there are misdemeanor charges filed against them. Safe havens in the Commonwealth really disrupt all of this and are a critical solution.
Is there a good number out there that we all should be aware of as we think about money and support of this program? You know, best guess, best estimate based on, you know, current communities being housed in different regions of the Commonwealth, current needs articulated. How many more safe haven beds do we need to really shelter people with dignity and safety?
What we're looking at is both a resource and an access issue. So the folks that we're talking about have been through so much, you know, the psychological trauma that we talked about. And when someone's homeless and they're homeless in a certain area, as much as they're disaffiliated from a lot of folks, they also still consider the community they're in to be their home. And so their home community, in other words. So the more we can have safe havens locally, when I think of the 4 counties in Western Mass, I would argue that every county should have a safe haven. So the person's not traveling across counties to get placed. Many people won't agree to do that because they've adapted and they have certain supports in the community they're already in.
Each program costs about $500,000 a year to run. And, you know, while that's an investment, it is an investment in making sure that we are ending chronic homelessness. And that I think can't really put enough of a price tag on. And so if we were to take, you know, she said 1,500 people who are chronically homeless in the state and divide that by these 7-bed facilities, that's a lot more money than we're currently talking about today, but that's a future goal.
So again, I want to just emphasize that they provide a safe location, a secure location, a welcoming location to transition people from the streets and begin to build for them the access to services and supports they need in a non-threatening environment. Since 2016, the Safe Haven program out in Westfield, Massachusetts, has served 38 people. 22 of these individuals have transitioned to independent housing, and only one of them was discharged from the program for non-compliance. Some others ended up in inpatient medical care along the way to deal with their very serious health conditions.
I hear so much conversation and so many questions and so much concern on the part of individuals in the communities that I deal with about places like Mass and Cass, and that's become kind of a symbol for a lot of things, but people tend to not finish the conversations that I'm actually hearing from you folks today, which is, okay, so what do we do with people? You know, a lot of people mean well, they want to be helpful. They don't understand homelessness, chronic homelessness and mental illness. They don't grasp it unless you've had someone in your own family. A lot of times you have no other reason to know. And dealing with those situations for a family or a community is pretty frightening sometimes. Just understanding that there are solutions, and programs like the Safe Havens programs really provide the structure for, okay, so what's the next step we do? We need more case managers. We need recovery coaches. We need placements. We need support services.
I hate to speak for my colleagues, but I'm willing to bet that Senator Comerford and Rep. Malia and I are going to be bothering you for budget amendments and more funding for this program. Please, Senator.
Oh, I was going to say, Rep, you can speak for me. I'm totally in. I'm converted and I'm on board in partnership with you and Rep. Malia. And so many others of our colleagues who care about
Right,
this.
right.
Yes, and absolutely. Every time we have filed anything or asked for support, there's been really an outpouring of assistance and guidance from other colleagues. So I want to make sure that we acknowledge that. So we will certainly be in touch with more information. And if there are questions, we are always happy to put you in touch with the speakers today or anyone in your area who might be able to offer assistance. So thank you so much again for being here. And we look forward to continuing the conversation.